This video has been created for you by the physiotherapists of the Nottingham Shoulder and Elbow Unit. It will provide you with the information you need to prepare for your surgery. On the day of your surgery, you will either be admitted to Theatre's Admissions Lounge or Surgical Short Stay Unit, both of which you can find along North Corridor. You will be given more information on this prior to your surgery. It is important to note that the surgery you are due to have is a day case procedure. Therefore, in most circumstances, you will not be expected to stay in hospital overnight. In this short video, we will cover the anatomy of the shoulder, the type of surgery you might have, what to expect immediately following your surgery, advice to help you manage when you get home, and where to find further information. Anatomy. This is what your shoulder looks like. It is a ball and socket joint held together with ligaments and muscles. As the socket is quite shallow, there is an extension of this socket called the glenoid labrum. This provides increased stability to the shoulder joint. The main muscle group around the shoulder is called your rotator cuff. This is a group of 4 muscles that further provide stability to your shoulder. They originate from the shoulder blade and attach to your upper arm bone. There are 3 shown in the picture. These are supraspinatus, infraspinatus and teres minor. The type of surgery you might have. Most of our shoulder operations are done arthroscopically. This is minimally invasive surgery that will not leave a big scar. You will have 3 to 4 small incisions around the top of your shoulder as shown in the picture. In some circumstances, your surgeon may decide to convert from an arthroscopy to an open procedure. This is more invasive and will leave you with a bigger scar extending down the front of your shoulder as shown in the picture. In order to have your operation, the anaesthetist will give you a nerve block. This means that you will be unable to feel your arm during and for a short while after surgery. You may then be sedated so that you will be asleep during your operation. This will be decided by you and your anaesthetist. What to expect immediately after your surgery. When you come around after surgery, your arm will be in a collar and cuff and you will have a dressing on your shoulder as shown in the picture. Depending on what surgery you have had will determine whether you need to wear a sling and how long you will need to wear it for. Some procedures do not require you to wear a sling as it is really important to start moving your arm straight away. If you do require a sling, this is what it will look like in most circumstances. You will be informed what sling you need to wear when you are seen by your physiotherapist post-operatively. They will advise you if you need to wear a sling and how long you need to wear it for. They will teach you some comfortable sleeping positions, how to wash and dress, and teach you any exercises you may need to do. These exercises will vary depending on what surgery you have had and your physiotherapist will instruct you further. For those of you who do not require a sling, you will only need to wear your collar and cuff until the nerve block has worn off. You should make sure you have full sensation and control back in your arm first. This usually takes between 12 and 48 hours. After that, you can start normal use of your shoulder and commence your exercises. If you are having any other procedure, the time you spend in a sling will be anywhere from 2 to 6 weeks. You will be advised by your physiotherapist. When you are wearing your sling, you must not use your arm for any activities. You may only do the exercises that have been prescribed to you by your physiotherapist in the way that you have been taught. This is to protect the repair of your shoulder. What to expect after your operation. You will need follow-up physiotherapy to help you make the most of the surgery that you have just had. You can have this physio at a range of locations and this will be discussed with you whilst you're in hospital. You will be required to attend a follow-up clinic appointment which is run by our specialist physiotherapists alongside the consultants. You will have around 3 appointments depending on what procedure you have had. These will roughly be at 4 to 8 weeks, 3 months and 6 months post-operatively. If you have had a rotator cuff repair, you will not be required to attend the first clinic appointment as you are reviewed in the outpatient department by the shoulder physiotherapists. Should they have any concerns, they will ensure that you are reviewed appropriately. Recovery. It is important to remember that the following advice is a guideline only. For further instructions, please refer to your patient advice booklet or ask your treating physiotherapist. Driving. You can usually start driving when you have come out of your sling and you feel confident that you can control the car in an emergency situation. It is good practice to speak with your insurance company to check that you are covered to drive following your operation. Strength. If you have had a soft tissue repair, for example a rotator cuff repair or a stabilisation, you can start strength training at 3 months following the date of your surgery. Otherwise, if you have had a different procedure, you can start strengthening exercises sooner under the supervision of your physiotherapist. Return to work. If you are due to have a subacromial decompression or a capsular release, you can return to work at 2 weeks if you have a sedentary job. 6 weeks plus if you have a heavier manual job. If you are having a rotator cuff repair or a stabilisation, you can return to light work when you have come out of your sling and comfort allows. For those of you in heavier manual jobs, you can start to think about a phased return to work after 3 months. This table summarises the likely return to work timeframes following your surgery. Again, it is important to remember that these timeframes are meant as a guideline only and you should always check with your physiotherapist before you wish to return to work. Further advice and information. Should you require further advice and information, you should dial the City Hospital campus number shown on screen. Listen to the recorded message and then dial the appropriate extension number from the table on your screen. Alternatively, you can visit our website. Thank you for listening. We hope you have found this information useful and we look forward to seeing you soon.